Good morning, everybody. Good morning, everybody, and welcome to AIM Impact on Your Health. AIM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AIM Impact on Your Health is heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. And I'm Dr. Dennis Courtney. I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AIM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, fascinating health topics, and of course, where we do encourage you to call in to join in today. Well, it's our last live show in this week because, well, special week coming up. Wishing that all of you have a very wonderful holiday and Thanksgiving with your family. I know I plan on having one with mine. On Friday, we'll spin one from the vault. I think we're going to bring back Shannon Gosen. It's timely to talk about frequent specific microcurrent therapy. And so we'll do the initial show we did with Shannon this month, and I hope you enjoy it. It will be a theme coming up, an ever-present theme as the months roll by here in 2015. So that'll be our repeat show on Friday. Hope you enjoy it. Now, we do turn the page so that we'll be moving into a bunch of new shows and themes very rapidly as we move into the month of December. I should say, however, that today's show is just going to be open them up to you. We'll have a number of things I can share with you, but it's open phone completely. You can come on in at any moment and set the agenda as you see it by dialing us up at 412-825-6262. That's 412-825-6262. And I'll give that number additionally throughout the hour. Open phones today. You call, you set the agenda, and we'll march to your drum. All right. On Monday, as we begin December 1, Susie Weiss is going to be our guest. Of course, Susie's just off of a wonderful event that she held last weekend at the Cherryton Plaza Embassy Suites. It was a full day of activity for Young Living and about the subject of essential oils. I'll have her give us a recap on all the festivities of that day. I was there for most of the day, and I can report that everybody was active. They were volatile. They were into it, and Susie looked as though she was going to have a great remainder of the day. We'll find out how things went when I left, and get her prepared to come to my office on Thursday, December 4th. Now, that's the first Thursday of the month. That's traditionally when we like to have a free seminar for those who have interest in learning about essential oils. This particular one, because the time changes a little bit with each one, is going to be at 10 o'clock in the morning. So if you'd like to learn more about essential oils, maybe you were in the group that was out there at Embassy Suites spending the day, and you like to learn a little more one-on-one because it was a large group, then give us a call here at the office at 724-942-3002 so we can reserve a seat for you, usually about an hour, at the most 2. Sometimes the folks linger on even longer. They want some more private time, and this day, with a 10 o'clock start, probably able to do those famous Zyto scans. Susie Weiss, our guest on Monday as we kick off the new month. Then on Wednesday, we missed her last month, well, because of a little snafu with the radio shows here. But she is going to be back with us. Dr. Vava herself, Dr. Susan Smith-Jones, will return after a month's absence in an accidental sense, and she'll be raring to go, as I'm sure you would expect. Now, on Friday, although you won't know of it, on Friday afternoon at 3 o'clock, I'm going to be recording our Monday show. The reason I'm going to be doing it at 3 o'clock is I'm going to be calling and talking with Dr. Ty Vincent, who is going to be bringing the show to me. Well, we're going to record it while he's at home in Wasilla, Alaska. And there's a 6 or 7, I'm not really sure, 6 or 7 hour time difference they are behind us. So it'll be 10 o'clock in the morning or thereabouts his time. It'll be 3 o'clock in the afternoon my time. And we'll record the show, which we'll then play for you, our listeners, on Monday, December 8th. Now, you don't want to miss this. LDA is making a return visit to our airways and big topics for discussion, because although it's been a successful therapy for many, it has been refined to the point of almost making it 100%. But the new disorders that we can now treat and reverse, I believe you're going to be very interested. If you have Lyme's disease, any of those chronic fatigue syndromes, you're going to want to hear more about it from Ty Vincent. I'll get our guest, unfortunately not live, but he'll be our guest on December 8th. And we're going to do it again in the month of January, where I'll record them on a Friday and bring them to you on a Monday. I'll let you know which date that is. This particular topic on the 8th is going to be on autologous antigens. That's where I think we missed the boat for those that weren't able to get their problems corrected. We just needed the right antigens. And so now we can go get them from you. He'll describe autologous antigens on that day, and you don't want to miss it. The other person you don't want to miss is Shannon Gosen. We brought her to you last month. It was her second visit with us. She's been here twice now, to bring you messages of how microcurrent can change your life. We were first introduced to microcurrent through the work of Dr. Ed Kondrat, pretty much consigned to using microcurrent to benefit eye problems. In fact, got rather comfortable with how well microcurrent can work with eye problems, almost to the exclusion of every other anatomical part of the human body. But do not fear. In October, I met all the movers, the groovers, and the shakers throughout the country who work in using microcurrent for everything else other than the eye, and what a pleasurable experience that was. I intend to share with you in 2015 all of the benefits that I think come with microcurrent, with a heavy emphasis on the show on microcurrent and a heavy emphasis in this office on microcurrent. The role for FSM, which is the lingo for frequency-specific microcurrent, has now come, and Shannon Gosen looks like she can illuminate the pathway that we can all follow. Shannon is going to be our guest on the 15th of December, where we're literally going to be launching a program called Second Call. She alluded to it when she was on the show with us the other day. We may talk a bit about that today if we have some time. So, as it stands right now, they are the up-and-coming guests, and a little bit about each one, every one of them. For our schedule goes, we can close that segment of the show. Why don't we do this? Let's take a short break so we can switch some gears. And I'll let you, if you got a mind to come on in and dial us up at 412-825-6262. I'll be happy to let you in the story, and you can take over the thing. I'll be talking about some of my favorite topics in the meantime, a bit about the LDA, a lot about frequency-specific eye programs in the month of December. Geez, if you are afflicted, what a wonderful Christmas present it would be to get your vision back on track. We'll talk about that. We'll talk about many things when we return. We'll be right back in just a moment. Good morning, ladies and gentlemen. Welcome back once again to AIM Impact on Your Health. Here in a Wednesday morning version of the show, it is a pre-vacation show to the extent that we're opening them up for you today, the lines that is, for you to come on in and set the agenda as you might see it. We talk a lot about a number of topics that may get sometimes a bit confusing. Today would be a great day to straighten out whatever questions may have developed over the course of the last few weeks. The number to do that, as you should know by now, is dial us up at 412-825-6262. That's 412-825-6262. Question or comment, any form of communication is okay with me. And I'll listen for that knock on the door, and I'll let you in the store. Now, I want to mention this website. I hear in the background a lot of times that the KHB is very nice to mention that all the radio shows we do, if you are, of course, within the sound of this signal, you're probably listening to this live. I mentioned one time, I caught the show all the way up. Now, it was crackly. Don't misunderstand me. Cleveland, Ohio. I could hear this show. That's how far this signal can travel in certain atmospheric conditions. I'm not going to say that what maybe wasn't a fluke, but that was pretty far for the KHB signal. But other people have told me that live much closer, look, you're coming in crackly. I have a difficult time hearing it. Well, you need to listen to the show while we stream it. So while we're doing the show on the radio, if you're having difficulty with reception, head to your computer, dial up my website at djcmd.com, and on the opening page, click on the icon marked Live, because that icon is there also. And when you do that, it brings you right to the YouTube so that you can listen and watch the show as we put it on each and every day. I've been amazed when patients and individuals have said, I didn't know I could do that. So that's one way of making sure you get a clear signal. Just head to the computer. Heck, if you're not computer savvy, let one of the grandkids help show you how to jump on this thing to make it a lot easier. You don't need to be holding your radio up to your ear with one foot in the bathtub and the other hanging out the window. We used to do with AM radio. And then, of course, as we complete each and every show, it gets logged on to the archive component of the website. And I keep mentioning that a lot of goodies are there. Literally every radio show I've done since 2003. Now, that hasn't been all my radio shows. We had to sort of cut it off for reasons of sanity. But, you know, that's a lot of shows. That's 11 years worth of shows, doing them 3 days a week. You should scroll through them. I know Dave Fish does. He keeps coming up with shows I even forget that I did. But the guests are very illustrious. The topics are actually, in many cases, still very timely. So I just mentioned to you that there's a way to keep on staying in touch with what we do here. Even when, for instance, you're too busy to listen to the shows as we do them live, they're always waiting for you when you get back home. So put it on the background while you're making dinner or while you're eating dinner. Just there's a great way to continue to stay in touch with what we present here. And some of it's such high quality that might very well behoove you to do just that. Now, I have programs, you know, and we've been involved with Dr. Ed Condrat now for many years. Of course, Dr. Ed is a Pittsburgh guy, born and raised. Had his practice, a very conventional practice out in Mount Lebanon, and he did as steady a diet of conventional ophthalmology as could have been practiced in that day. He was doing the LASIK surgeries, one of the first, but radiokeratotomy, one of the first, the lens implantations, and all the other conventional treatments. But at one point, about 13 years ago, he just chucked it all in, left the area, left the Pittsburgh area, and headed on out to Phoenix, Arizona, and put his head to the grindstone to come up with a non-toxic, non-invasive, non-surgical treatment for these very serious eye problems that we come to talk about quite a bit here. Now, I'll get back to this topic for those of you who may have eye afflictions. and how you might be able to get that turned around through the programs we offer. But I think we do have a knock on the door, so why don't we let them in the store? Hello and welcome aboard. What's on your mind? Go right ahead.
Yeah, Dr. Courtney.
Yes.
Oh, question. A couple of weeks ago, you were mentioning you were going to have a guest on about vitamin D. That his blood levels were like 400.
Yeah, I know the guest you're talking about because his name is Dr. Ty Vincent. He's the doctor from Wasilla, Alaska,
Okay.
and he's going to be talking to us about LDA. And I promise, first of all, he feels very strongly about vitamin D. In fact, I'll let him recount the story. He took 50,000 units a day of vitamin D for a many-month period. I think like 7 months. Okay, and that's how he got to those levels of 500 and 600, which, according to him, he certainly didn't feel bad at all. I think what he was trying to say to our audience when he revealed that is that there is no toxicity when it comes to vitamin D, and anybody who's squeamish about the use of vitamin D, thinking that you can get toxic from it, it's pretty. Well, you don't have to do 50,000 a day, but he did, and he had other patients of his do the same, and everybody did fine. Nobody got toxic, and I probably feel that they were enriched by it. So I'll let Dr. Ty Vincent get in and off topic of LDA a bit, because I think he has plenty to share with vitamin D that you could all benefit from. But that's the name of the guy. He's coming on board. I'm looking right now. He's going to be my guest on the 8th live, but I have to ask him the question on Friday the 5th, and I'm going to write it down right now.
Okay, that sounds good.
Okay, anything else?
That'll do it.
Okay, you keep listening now and be there for the 8th. I promise to ask the question about vitamin D.
Okay, thanks a lot.
All right.
Bye.
Yeah. This Ty Vincent, by the way, he's what you call maverick. And I was just reading his book. I got it online, and I think he opens the book by saying, "Rules. I don't listen to rules. I don't follow rules. Rules bug me." And so he would be just the right guy that would say, "Vitamin D, 4,000 units? I was thinking 4,000 units. I'm doing 50,000 a day, and try that one on." Anyway, you'll get a kick out of Ty Vincent, because that personality of his just comes across, and we love him. We love him a lot. Hey, we got another knock on the door. Come on in the store, and hello, and welcome aboard. What's on your mind?
Good morning, Dr. Courtney.
Hi.
Happy Turkey Day.
Hey, yeah, I hope you have a wonderful holiday.
Thank you. I had a question. I recently had some dental work done, and I'm still trying to recover. But one of the things was the gum debridement, and I had to have what do you call that? The cadaver bone added to the back of my molar.
Oh, that had already the gum disease had gone that far deeply into the tissue, huh?
Well, it's funny. Back in this is back in '87. I had my wisdom teeth pulled, all 4 quadrants.
Okay.
And I remember I think it was Dr. Chelko, he said, remember, one was impacted in the bone and one was impacted in the gum when they were removed.
Oh.
I mean, all 4 were removed in 20 minutes. I remember that. I was like 16 years old, but they think that the one that was impacted in the bone, the wisdom tooth that was impacted in the bone, was the one that I'm having a problem with. So, yeah, they had to add bone to that. I'm sure over the years, I had the bone in addition to that. But anyway, the gum line behind that tooth is like nothing. There's like no gum. It's all,
Sure, it's a big pocket.
Below.
There's a giant pocket that leads right down to the bone itself, which has to be
For
cleared away.
In your opinion, and I don't know if the microcurrent or something could help with tissue regrowth. I'm a diabetic, because tissue healing and all that is very, very compromised and slow in me. So anything that could help speed it up?
I'd say microcurrent, as you're going to find out, is going to potentially play a role in anything we treat. And patients that come here, I believe, if they're sitting still for too long, you're going to find they got 2 probes, one in each hand, and a microcurrent program is going to be run on them. And they're just that good. So, yes, there always should be a microcurrent consideration. I would say that in the case where we're worried about microbial infection.
Yeah.
And certainly with gingivitis and deep pockets, we are worried about it. Ozone therapy with the ultraviolet blood irradiation is an excellent antimicrobial double whammy combination. Also, too, that, and we do them, the periapical injection of ozone directly into the gum line is probably an excellent therapy. And I know that biological dentists are really reveling in the use of ozone now. Ozone is their big thing for 2014. I think is pretty much when everybody said we're going to get one of the units. And so I know Dr. Bizzato is now able to administer ozone apically, periapically. We've done the ozone injections periapically for those who have dentists that don't. So I think that's the antimicrobial help that really you should be looking for when it comes to the infectious issue, which is the primary thing that they're working on right now. And then microcurrent, yeah, I think a great adjunct that when you go home, there's a program that you can use to get this stuff back, the tissue that is working back to its optimal again, and be in control of those treatments at home. So you can get injected either IV or locally with the ozone in an office, and then go home with the microcurrent. I see those as two wonderful therapies as the machines. And I can say this much, right now the devices that we are using are called InspirStar. And InspirStar has a device that allows us to program it for 10 different things, just 10 programs. Now that's a lot of programs, but that's not the level of programming that we'll have by March, when InspirStar is making another device that will allow us to program 44 programs. Literally, that means then that a family could have just about everybody in the family have their medical needs met and have an in-home way to treat themselves. So look for that approach to in-home therapies that just haven't existed before, but have the utility of one device being able to service everybody in the family, which would make it very economical too. I just passed that on.
What was that called? I'm sorry. What was
the name of the company?
the one that you're going to be having? Yeah.
Yeah, the name of the company that right now they don't even make this machine. It won't be available till March, but they do make the device that we use that Dr. Ed Conrad helped put together. It's called InspirStar.
InspirStar.
InspirStar. They're on. They got their own website and everything. And if you feel like, geez, I never heard of that before, when I tell you the name of the guy who owns the company and develops these programs and devices, if I say his name, and his name is Ning Wu, does it make you feel better? Makes me feel better. And by the way, Ning Wu's father is the head of the electrical engineering department at the University of in China. And so this kid was playing with circuit boards, not basketballs, when he was little. And he's a great guy. I'll bring him on the show. I promise you, as the months tick by in 2015. Okay.
The one thing I am doing, just to for my that gum in the tooth, is I'm putting it's ozone infused olive oil. I'm putting it around that area. I know topically is probably not as good as the injection, but
hey, no, it's a very good way. And when you have ozonated olive oil and impregnate it with olive oil with ozone, it retains the amount of unbelievable for 10 years. Okay, like we use eye drops made with water, still water, for our eye patients while they're here. The eye drops, by the end of the day, they don't have any more ozone in them. They only hold that ozone for a very short period of time. But olive oil holds it for 10 years. So
really?
Yes. So that's the concentration.
That little jar would last. That little jar would last 10 years.
No, it's.
When I put it on my tooth, it's lasting for 10 years.
The potency of the ozone content of the olive oil remains that potent for 10 years. I think that's pretty amazing.
Okay. And the other thing I'm doing is swishing with bentonite clay.
Yes.
And water, gargling,
detox,
swallowing, sometimes spitting it out, and that was at the advice of my dentist.
Yeah, I agree. That sounds like a wonderful therapy in conjunction. You got to get that infection cleared. Does your dentist himself use ozone? Does he use it?
She does, yeah.
She does, okay.
Yeah.
Is that the Di Gregorio gal up in there? Is her name Di Gregorio?
Yes.
Oh, you know what? I don't know her personally, but I have such great things to say about her because I've got a lot of patience to see her. That gal knows what she's doing, and I thought she did have ozone available. I may be mistaken.
And I've heard very good things about Derek Rico, too, in Murraysville. I've heard excellent.
That's a new name for me, so maybe I'll start to hear about him. But I love to recommend dentists. There's so few in Western Pennsylvania. Everybody has dental issues, and they want to be corrected by a biological dentist. And I think we've made the turn. For the longest time, we had like 2. And now, just in a span of 6 months, I'm hearing 2 or 3 other names. And now you bring a new name for me today. I promise to support as I learn more about each and every one of them. I'll mention how to get hold of them. I like the fact that they're located throughout the various pockets of the population of Pittsburgh, and so they're geographically desirable, I guess is the best.
Yes. Can I ask you one more question?
Why not?
From all of this, okay. Way back, I want to say maybe 9 years ago, there was a product called PolyMVA that was from Dr. Gonzalez.
Yeah, it was a palladium.
I've never heard too much within the last maybe 7 years about that product because he claimed, I remember when I went to the Butler meeting group, he claimed that not only was it for cancer and as a, as a preventative for cancer for the immune system, but also for so many other conditions with the immune system.
Look, I remember Dr. Gonzalez.
Yeah.
And actually, there was another doctor from the West Coast, on the San Diego area. I'm forgetting him, but there was a big run on PolyMVA at that time. I remember it very well because I actually had him on my radio show. I remember this, and it was only on one time. But as I moved throughout the country and I talked to the docs in the country that do alternative approaches to cancers, I didn't find that this got much traction, which to me, if these docs that I know weren't really, embracing PolyMVA, it meant I never really did either. That's not to say it may not have been a fantastic product, but I have to agree with you. I haven't heard much about PolyMVA. If anybody out there has used it or knows somebody that has and can share it with us, I'll be more than happy to give you some airtime. But no, this one has sort of fizzled.
Okay.
All right.
Dr. Courtney.
Hey, have a great holiday now. Here you go. Checking a lot of medical issues going on, and we all benefit from that dental discussion. Gingivitis is what's claiming, and gum disease is what's claiming the dental arena. Tooth decay, pretty much a battle that's been won. Not much in the way of decay anymore, but the doggone gums are diseased, and these pockets develop that allow for food to accumulate within them and lead to raging infections that must be corrected. And so anybody with a gingival problem wondering how best maybe to combat that should be considering that combination of ozone therapy combined with ultraviolet blood irradiation. That double whammy antimicrobial approach has nothing that will prevent it. I want to share something with you. Hey, forgot about this, and I don't know why. Just got an email from Dr. Rowan, Dr. Robert Rowan, the famous Second Opinion guy. Well, he used to write the Second Opinion newsletter, and now Frank Schallenberger took it over. Anyway, I think you can remember me reporting to you not too long ago, like within the last month, that he and Harold Robbins, another ozone doctor, went over to Liberia, Sierra Leone. They went to Sierra Leone, right in the thick of Ebola country, and their intention was to take with them ozone and ultraviolet blood irradiation equipment to be able to teach the doctors who treat the ozone patients over there with this novel therapy they had never heard of before. Now, they literally were invited, as I find out now, by the president of Sierra Leone, the name of which eludes me. I promised to come up with the email, which if I went searching for it now, I wouldn't find it in time. But I got a report from Robert Rowan, and it goes something like this. I'm paraphrasing it, but I felt that the ozone and ultraviolet blood irradiation had a chance, a shot, of being able to conquer the Ebola problem. And I said at the time, you're never going to hear about it if it does, because the governmental agencies on this side of the pond are just not going to allow that to happen. And so what we have occurring now is I've got my first email from Dr. Robert Rowan, that a physician, get a load of this now, a physician who was working in a clinic treating Ebola patients accidentally got stabbed. He got punctured with the needle that was used to inject an Ebola patient. What a stroke of unluck, okay, to have that happen to you. And immediately, of course, the doctor became concerned, but he did not report it to anybody, because if he were to do so, he felt that he would be taken away from these patients, probably should be, because if there's any suspicion that you're infected, you have immediate quarantine regulations that come into play. So he didn't say a word. 2 days later, he began developing symptoms that the doctors of that time, and he himself, as being one of the doctors, recognized them as the initial symptoms of Ebola. At that point, he did get, without announcing that he had the symptoms, he did get a treatment of ozone and ultraviolet blood irradiation. And within 10 days after that, by the way, a treatment, if I read this correctly, and within 10 days after that, all symptoms have disappeared. Now, that's my paraphrasing of it. I promise to bring the actual email to you next time I'm here, but what I considered to be the only way that Ebola was ever going to get a chance to be conquered certainly wasn't going to be with the treatments that we use here, which are essentially fluid replacement therapies. It's a little bit of a joke, a little bit of a laugher when you hear, well, there's a patient coming over from West Africa to one of our hospitals to receive treatment for Ebola. Well, it's true. There's going to be a hospitalization and isolation, and the treatment is going to consist of fluid management, probably airway management, because of the massive amount of loss of fluid and blood that these patients experience in the latter stages of the disease. But the word treatment should not even try to indicate, and I don't think they're trying to do it, but they don't spell it out. There is no treatment for the virus. The virus will have to run its course. The conventional treatment requires very profound and invasive fluid therapies while they're waiting for the virus to die off by itself. And if they can get ahead of these fluid losses and let the course of disease run so that the virus dies off on its own, that could potentially yield to a successful treatment. However, nothing, and I mean nothing, was given to try to kill the virus, except occasionally I hear about they do a blood transfusion with one of the people who had Ebola to see if antibodies are found in that donor's blood that could help combat the disease. That I have heard of. But if this, and Rowan, pretty honest guy, I got to tell you, he wouldn't be inventing this story. If this in fact is true, I've always felt that Ebola had a chance to meet its match with the combination of ozone therapy and ultraviolet blood irradiation. That double whammy kills all bugs. Ebola is just another bug. It's no more, no less harsh a bug as any other bug. It's just a virus, and we have in conventional medicine no good antivirals at all. In fact, you can read where chicken soup is probably as good with the viruses as these very potent antivirals, which don't work at all. I promise to bring you that email. more on the subject as it unfolds. We got a knock on the door. Come on the store. Hello, welcome aboard. What's on your mind?
Good morning, Dr. Courtney.
Hi.
I wanted to ask about the two things. The dentist, name of the woman dentist. What was her name again, and where is she located?
Was it Dr. D. Gregorio? Last name, Dr. D. Gregorio. I don't know her first name, but she's located, I think, in Shadyside. But look it up. She is announced herself as a biological dentist, and I have many patients who have been seen by her. I sort of have followed what she's done, and I can see she was trained right, and I can't recommend her any higher than that. She's doing exactly what biological dentists should do. She's doing a heck of a job.
That's good. I actually go to the other dentist that Dan, that the other caller had mentioned, Dr. Derek Rico.
Oh, okay.
In Murraysville, and he's excellent. He's a Huggins-trained dentist, and all of his staff have also been trained. And he's, mercury-free, and he's very good. I don't know. I haven't been to him like recently, so I don't know if he's doing ozone or not. But I would certainly check that out with him, and you too might want to.
Oh yeah. And by the way, you said a mouthful when you say he's Huggins trained.
Yes.
There's a lot of baggage, the good baggage, that comes with that kind of a moniker. So it makes me feel better. The first time that word has been used with respect to that dentist before. And boy, if he has been Huggins trained, all the more reason to support him. And I'm glad to hear that you feel very good about your experience with him.
Right. And the only thing that he doesn't do, he doesn't have the ability to do vitamin C IV.
Right.
But I mean, he knows about you, and I don't know who else does the vitamin C IV, but he used to be able to send his patients down the street to get the vitamin C IV, but that's been a couple of years now, and that's no longer worked out.
Yeah, I'm sorry that it isn't, and but although the distance travel, I mean, people are out in McMurray. You live in the Murraysville area, do you?
No.
Oh, you travel that far to be treated by him?
Yes.
Oh, goodness. Well, let's just say we have certainly worked with many of the biological dentists doing their vitamin C injections or IV infusions on the same day that they get the work done, just like Huggins described you should do, so that there's a way that if you could pass this on to the good dentist. I certainly wouldn't mind speaking him and allowing him to actually come aboard on the show. I want people out in that area to know that he's out there.
I'll call later and give Kim his phone number.
Please do. I'll talk to him.
Other thing is, it was very interesting at the end of the show on Monday, the guy talking about his, issue with, I guess, Hashimoto's and the LDA.
Uh-huh.
So I have two questions about Hashimoto's. My understanding is that, of course, if you have thyroid antibodies at a certain level, that's considered a pretty significant clinical sign that you have Hashimoto's. But there's controversy about whether or not if you have any level of antibodies, is that also Hashimoto's? Do you know anything about that?
Well, there are 3 antibodies that I order to determine if one could be considered Hashimoto's. They are perioxidase antibodies, anti-thyroid antibodies, and antimicrosomal antibodies. 3. And so we order all 3 to make certain that if one, and by the way, it's quite common that only one of those ever really is out of whack. Sometimes it's the anti-thyroid, sometimes it's perioxidase, sometimes the microsomal. So if they're all 3 are negative, we drop the subject. It isn't a matter for consideration to do any treatment. It's when any one or numbers of those are elevated that you meet the criteria to be diagnosed as having Hashimoto's disease, which is a form of thyroiditis. Yes.
Well, I guess that's where I've read, as far as the controversy, what level of those specific labs constitutes a yes or no.
Oh, well, I'll tell you, I have So let's say the level, and by the way, this is probably accurate, although I may be off by a point or two, but let's say the normal level for perioxidase antibodies is like up to 17, all right? By the way, that's about right. And it doesn't even matter what the unit is, the number 17 is what I'm trying to get across to you. So if somebody is at 19 or 20 or 23, I'm not going to make a big fuss about antibodies. But when I see them in the hundreds and then the thousands, it becomes very easy to go, you know what? This one has to be dealt with. Now, when I say dealt with, it I believe is another blemish on the neck of conventional doctors that although they can order the antibodies and they can certainly make the diagnosis, there is no treatment used to correct any of that. It's sort of like tucked in the chart. The label gets hung on the patient as having Hashimoto's, but nothing's ever done to shut that off. Even back in the day before we had a very effective treatment, which I consider LDA to be effective, at least we had standard process protomorphogens, and protomorphogens were supplements made by Royal Lee that could act as a decoy. So there was a supplement, a protomorphogen called thyrotropin. And what thyrotropin was animal thyroid that allowed the antibodies to attack it rather than the gland. Well, at least that was something. It was decoying the target tissue away from you to something that wasn't you, and your gland was spared. Because I believe over time, an increased insult of antibody attack against the gland has consequences and may very well lead to cancers and other serious diseases. So even when we didn't have LDA, we had the protomorphogen, but now that we have LDA, we can and should eradicate the antibody formation completely.
Okay. I guess I still have curiosity to argue that any level of antibodies is not good.
Yeah, these minor levels, I don't think you should worry about them. But if we're talking about you, probably want to see what the numbers are, because if you're into the hundreds, then we do have an issue that should be corrected. And I do have some patients sometimes are in the thousands.
Yeah, no, mine were very, very low and would usually be considered not Ashby's. It's just that, again, there's some debate out there about should there be any antibodies. But now, another question related to LDA treatment. Does someone, like, let's say someone comes in to you for the LDA, do you need to know that they have Hashimoto's, or is there kind of like a generic mix that you test everybody with?
Oh, we're going to get the antibody. First off, we do standard antibodies on every single patient. So a lot of times their doctors have even diagnosed them with thyroid disease, but they never took the time to get the antibodies. I think that's a little embarrassing. You got to do that at least once. So we run the antibodies on everybody, and when they come back and reveal that we have an issue, then we're going to have that discussion about what to do about those antibodies, so that at the end of the road, whatever path we take, it'll need to be a repeat of those lab tests to confirm that the antibody formation is no longer viable, that there are no more antibodies made up against the thyroid, and that would confirm that the treatment was successful and now complete.
Okay.
Okay.
And generally speaking, if someone has the antibodies at a level that is high, is that like always? I mean, once it starts, does it ever on its own rescind?
I will tell you that as I've followed many patients in the protomorphogen days, I never found it. It always maintained itself at a level that was abnormal, whether it was just a bit out of the abnormal and a little bit askew or way out of whack. It seemed to maintain the level of intensity that it was first diagnosed at. That's probably the best way to describe it. Yes.
Okay.
Okay.
Also, is there any kind of like age-wise? I mean, like, would you say like someone in their, I don't know, 20s, 30s is more susceptible to developing Hashimoto's?
Oh, well, it's apparent to me that it does develop in adolescence, and it looks as though, because when we confirm it to like a 30, 40, or 50-year-old, they tell me, oh yeah, that diagnosis was made many years ago, like when I was a young adult. So it appears like its initiation is almost always as a young adult or adolescent, but then it just continues for as long as the person survives.
Right. And like you said, if there's no treatment, then it's not really.
It just keeps on raging, and there's no, unfortunately, the conventional docs don't have anything to use, because they wouldn't think, to them, they've never heard the term protomorphogen. They wouldn't know what to do with that. So they file it away and just let it go, and I think that's not.
And one last thing about the LDA. So if someone comes in and they have ankylosing spondylitis, and maybe they don't even know they have that, how do you do the LDA? I mean, how do you know what to use in the LDA treatment?
Well, when it comes to ankylosing spondylitis, okay, which is a problem that the patient will suffer from, have pain, usually in the spine, up and down the spine. So they may already have a diagnosis based on markers that some other doctor has made, and then unfortunately not been able to do a thing about it. Ankylosing spondylitis is also an autoimmune disease, as is Hashimoto's. So once we've confirmed that the ankylosing spondylitis is actually, the pain in the back is due to an autoimmune disease, then we would say we need to treat them both, and we should be able to reverse both.
Okay.
Okay?
So the kind of bottom line with the LDA is people or you need to determine what the diagnoses are.
I find that the people already come to me and they're sitting across my desk, and on the first day they say, well, look, I've got some coronary artery disease. Oh, by the way, I was diagnosed with ankylosing spondylitis. These diagnoses seem to have been made rather commonly throughout their medical experience. So they already know. I don't think I've ever come up with the diagnosis of ankylosing spondylitis on my own. It was already known to them, and we work from there. Now, I'll have to take that and then come up with the antigens, the bacterial antigens for each one of those, but we won't let them rest. We should be able to reverse them now with LDA. Keep following us with Ty Vincent, and I think you'll see some good things happen in 2015.
Sounds good. Thank you very much.
Great questions. I hope everybody benefited from them. Very, very good questions on Hashimoto's. Got another knock on the door. Come on, the store. Hello, welcome aboard. Go right ahead.
Oh, good morning, Dr. Courtney.
Hey, how are you?
Almost fell asleep there, but they were good questions.
Hey, they were great questions. What's up, Dave?
To her first one is Tammy Gregorio.
Yeah, oh, her first name is Tammy. Thank you very much. It was Doctor to me.
Yeah, right. Obviously, it's Doctor. That's funny. Puredent is the name of her company, Puredent.
Oh, good. So people can go to her website and find her.
Puredent.net.
Well, there you go. There you go, folks. And by the way, is she located in Shadyside?
5830 Ellsworth Avenue.
Yes, she is in Shadyside. So there we go. If that's geographically desirable to you, or you're looking for a clinician that's, I believe, well-trained, is she your dentist too, David?
Well, I have a card in front of me. That's where the patient's coming from.
Okay.
I did have a procedure, emergency pulpectomy. And it was sort of brutal, but even worse was she has a dentist who comes up from Kentucky once a month to do extraction.
Oh.
Now that I would not suggest for the faint of heart. And anybody who goes for this type of dentistry, I would definitely recommend they learn what I had learned years ago from a friend of mine, hypnotherapist Tom Beardshaw. It's called the Dave Elman induction. And you can use this to hypnotize other people, or it's self-hypnosis. And if you don't have that tool with you, I would definitely recommend. I know some of your other patients who have gone through the process, and they describe it as brutal. And it was even brutal for me, being able to go into that state that I go into.
Mm-hmm.
There's a reason for that. And I had personal experience with this years ago. When I had my mercury fillings taken out, the dentist who worked on me they used like an epinephrine in their anesthesia.
Mm-hmm.
And I had two teeth, on that side it was my eye teeth that basically just died. The paintball, they just sort of, the teeth died. And I learned from a Dr. Kulotz, who used to be on Deborah Ray's show.
Oh, I know him very well, Bob Kulotz.
Okay, and I called that show, and I told him about I had these two eye teeth done. He said, well, have you had any work done? I said, yeah, I had my mercury films taken out. He said, well, I didn't even tell him it was my eye teeth. He said, I just said, well, my teeth died. He said, I bet it was the eye teeth. Yeah, how did you know that? And he said, well, what they do is use this epinephrine in their anesthesia so that it lasts longer. And what happens is that will end up stopping the blood flow to those teeth, and those teeth will die. It's very common. So I guess Tammy is and her dentist from Kentucky does the extractions, know this about the anesthesia. So you're not going to be, they don't use a twilight. It's not the pain-free dentistry. Let's put it that way.
Oh, that's pretty gruesome. I've
had extraction before. It was like a 10-minute thing where boom, it was out. I didn't even know it happened. But this was maybe 45 minutes, and it was, it was brutal.
I'm already grabbing my own jaw. That's enough, Dave. That's enough already. My goodness.
I said, learn that Dave Ellman induction before you go.
Dave Ellman from Tom Beardsall. I haven't heard his name come up in a long time. He's located right in my backyard here somewhere.
He come up as a guest. He wrote a book, How to Be Happy. Tom's a great guy to do hypnotherapy classes with him, and other things we used to do together. I've lost contact with him too recently, but I know he's still there, still around.
All right, guys. Thanks for the call.
All right, thank you, Doc.
Mm-hmm. There you have it. Dave Fish with a Tammy DiGregorio report. Dr. Tammy DiGregorio, puredent.net. I got a picture in my mind about that guy from Kentucky. It's not a good picture. Hey, we're really in this gun lab portion of the show right now. I want to thank you for the great questions you had today. I want you to keep in mind that LDA is going to come front and center, as well as FSM. I think sort of has three initials. LDA, low dose antigen. FSM, frequency specific microcurrent. Going to play a large role in this office, the two of those, in the year 2015. Ty Vincent, I got to read this little thing about, make sure that I ask him about vitamin D, because he's got a great story on vitamin D. And he's going to be our guest on the 8th of December in terms of a pre-recorded show. And then for those of you that map these out, and I know some of you do, the second show is going to be on autoimmune diseases of all types, and in particular Lyme's as an autoimmune disease, which we now know that it is. And he's the guy with the track record of 38 out of 40 successes within a 6-month period. Folks, it's going to blow the lid off on Lyme, I believe, this year. Ty Vincent, our guest. He'll be on the second show. We'll be here on the 12th of January. And, of course, there'll be many other shows in between. I wanted to bring to a conclusion sort of what those of you who were listening to the I program component, we started there, and then I got a lot of phone calls, which I really enjoy. But the I programs that we offer go to the heart of these retinal diseases. I think that's the big decision point. If you have a retinal disease like glaucoma or macular degeneration or diabetic retinopathy, you have learned, unfortunately, that there is really no treatment for you in the conventional medical world, and there certainly is no restoration of vision that has been lost. Unfortunately, it usually has been lost and is being lost at certain rates of degradation. That's what changes from person to person. So I got to tell you, if you have any of those disorders, you want to hear about our Pittsburgh Eye Protocol. This is an affiliate with Dr. Ed Condrat Healing the Eye and Wellness Center located in Dade City, Florida. Dr. Condrat really doesn't do the protocols anymore. He relies on other doctors that he's trained throughout the country. We happen to be that Pittsburgh representative and hold one of these 3-day treatment programs each month here in our office in McMurray. So if you want to learn more about it, either for yourself or for some other member of your family or acquaintance, give us a call. All right, folks. So our bongos in the background. Coming up, I want to tell you, Thanks for spending the time with us. Have a very enjoyable holiday. On Saturday, we're going to repeat the show we did with our girl Shannon, our first show, which was from October 20th. October 20th. Until then, this is Dr. Dennis Courtney saying so long for AM Impact on Your Health.